What is pancreatitis? Well, itis stands for inflammation, so it literally means inflammation of the pancreas. The pancreas sits right behind your stomach, almost against the wall of your back, and it's this gooey sac that makes and secretes digestive enzymes and hormones. After a meal, the pancreas starts dumping the enzymes into your intestines, and their job is to break down big molecules of food into their smallest components so your body can use them. There's lipase, which digests fat, amylase for carbs, proteases for proteins, you get the idea. The pancreas also secretes hormones like insulin and glucagon into the blood to help your body manage the nutrients once they've been absorbed. Okay, so that's the pancreas, but what causes it to get inflamed? Sometimes it's idiopathic, which is an obnoxious medical term for we have no f***ing clue. But a lot of the time it's gallstones because they can clog the pipes and back up the pancreas. The other big one is alcohol. For some people, drinking too much really aggravates their pancreas. Trauma can do it too. Then there are a bunch of rare causes like viral infections, steroids, autoimmune diseases, scorpions, some medicines, the list goes on. So let's say you drank way too much, or maybe you got stung by a scorpion. Now your pancreas is inflamed and it hurts. People complain of a terrible gnawing upper belly pain that often shoots to their back. And that makes sense because the pancreas is in your upper belly and close to your back. You also feel super nauseous and can't keep anything down. The pancreas' job is to digest, so that makes sense too. And those digestive enzymes, they're supposed to be stored in an inactive state, but they get activated by inflammation and start to digest the pancreas itself, and they leak out all over the place, breaking down your own tissue and making the situation even worse. Some people can run a fever. If your doctor thinks you have pancreatitis, she can diagnose it by measuring blood levels of lipase or amylase. Why? Because those are the enzymes that are supposed to get dumped into the intestines. So if you find them in the blood, that means your pancreas is leaking. Doctors can also order a CT scan where you can actually see that the pancreas is inflamed or has fluid around it. The best way to treat pancreatitis is to get rid of whatever's causing it, if we can find it. So if it's a gallstone, we can pluck it out. If it's alcohol, well, there's always AA. But in addition to that, doctors will want you to stop eating and drinking completely for a few days. After all, eating activates the pancreas, so it seems pretty reasonable to let the pancreas chill for a bit. In the meanwhile, you'd also need IV fluids to prevent dehydration and medications to deal with the pain. Usually, an acute attack of pancreatitis will resolve, and amazingly, the pancreas can fix itself up. But if this keeps happening over and over again, the pancreas starts to get scarred and less able to do its job. We call this chronic pancreatitis, and the most common cause is actually alcoholism. Over time, people lose the ability to digest food, so they start having diarrhea and losing weight. And the risk for pancreatic cancer goes up. What sucks is that we don't know how to transplant a pancreas yet, and you pretty much need a pancreas to live, so if you lose your pancreas, well, you get the idea. The good news is now that you understand pancreatitis, you'll be able to keep your pancreas healthy and happy. If you have a medical condition you want to learn about, let us know. Thanks for watching.